Hey guys, and welcome back to the upper hand. Today we're going to talk about wrist isometrics, what that is, and when to use them. So first, it's important to know what an isometric is. An isometric exercise is when a muscle is contracting, however there is no movement going on at that specific joint. Let's take for instance the wrist. If we want to work the muscles that control wrist flexion and extension, radial and ulnar deviation, those muscles are located right here in the forearm. If we want to contract those muscles and give those muscles a workout without moving the wrist, we would perform an isometric contraction. And I'm going to show you how to do those today here in just a second. But let's talk about why we'd want to do that. So think about somebody with a wrist sprain or wrist strain. You're not going to want to have them doing, a lot of weighted wrist exercises or TheraBand resistive exercises. That's going to put a little bit more strain on the wrist. So we can strengthen the muscles of the forearm without moving that wrist and further hurting that ligament that's already sprained or strained. So how to do those? Grab you a towel or some form of buffer between the table and your hand because you don't want the patient pushing into a hard surface. So there's 4 different exercises that we're going to go over for the wrist isometrics. First, we're going to focus on wrist flexion. So for wrist flexion, we're working this motion, but again, there's going to be no motion of the wrist. So we're going to take this portion of the hand here, and we're going to be pushing that into the table, and you're going to have them hold that for 5 seconds. So 1, 2, 3, 4, 5, and relax. And then they're going to do that however many times you want, but usually we start with 10 and kind of work our way up to 30. Once you get to 30, then most likely you're ready to move on to some form of weight strengthening or any kind of TheraBand, resistive TheraBand strengthening, something like that. So just to review, pushing into the table, make sure that your patient's not bowing their wrist up or their hand up like this. If that's the case, they're just going to do more damage to that ligament that's sprained already. So make sure everything stays completely flat. A lot of times I'll have the patient kind of feel for that muscle and they can immediately feel that it's firing because it gets really tense and tight. And again, we're going to do 10 of those and we're going to move on to the next one. So wrist flexion, pushing the palm side of your hand and fingers into the table. For wrist extension, you're just going to have the patient put their hand right on top, and now they're going to resist that wrist coming into extension. So up, and you can see the muscle firing as soon as that muscle contracts. So you can have the patient visibly see that, and also palpably they can feel that as well. Same concept. Up, 1, 2, 3, 4, 5, and relax, and we're going to repeat that 10 times. Next, you'll go to radial and ulnar deviation. Doesn't matter which order you do these exercises in, but we'll go ahead and do ulnar deviation first. So moving the ulnar side of the wrist into the table, wrist and hand. So again, make sure that wrist is not bowing up when you do these exercises or when your patient does these exercises, because you're just going to put more strain on what's already injured. So hand flat on the table just like this, pushing into the table, 1, 2, 3, 4, 5, and relax. Again, repeat that 10 times and before you move on to your next exercise. Last one, radial deviation, same thing, have them put their hand right on top. Now they're resisting this up motion here. Radial deviation of the wrist, same thing, don't let that wrist move. If you're moving through your hand on top, you either need to push harder or just don't pull up quite as hard here because that muscle's already getting a good workout. So pull up, 1, 2, 3, 4, 5, relax. Do those 10 times and you're done. So again, that is for us, that's a good precursor to strengthening. So if somebody is dealing with a lot of wrist pain, you may can start with those before you work to your weighted wrist strengthening or your TheraBand resistive strengthening. As always, if you guys have any questions, just drop them down in the comments. We'll see you guys next time. Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video, and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.